Hi everyone, this is Dr. Stefan. In this video, I'd like to answer a very popular question, and that is how to clear mucus from the airways, from the lungs. This is a very common problem affecting people who suffer with chronic respiratory diseases, such as bronchiectasis or COPD. And it's generally a mechanical problem, either related to more mucus being produced, and this would be the case of COPD, where the cells that line the airways change in their structure and the type of cells that's lining the airways changes, or in bronchiectasis where there's a structural problem. There are some dilated areas of the airways where mucus tends to build up, so you can't really bring that up easily. So it's really difficult when you're trying to bring up that mucus. It's really bothersome. You have a wet cough, but you can't bring up the mucus, so that can be extremely difficult to deal with. So here are 8 tips or things you may want to consider. The first one, try to be well hydrated. So if you are dehydrated, you haven't had enough to drink that day, you're not drinking plenty of water, fluids, soup, tea, whatever you prefer, you're probably going to have much drier mucus in your airways. So that's going to stick to the airways and make it that much harder to bring up. So try to keep well hydrated to keep the mucus nice and loose, and that will generally help you bring it up a little bit easier. The second thing would be to cough progressively. So this is where I need to probably explain things a little bit. So many people, when they have something stuck in their airways, there's a little bit of mucus they can't bring up, they tend to just have a burst of coughing and they go like, or something very sudden. And that usually tends to just collapse the airway because the airflow is really quick and just pulls the airway shut. So if you're progressively coughing, so something like then you might actually make it easier for that mucus to sort of slowly move up. The other thing you may want to consider before you actually start to try and cough it out, to take a few very deep breaths to actually stretch out the airways, stretch out that mucus, make it sort of loosen from the airway walls, and then you may be able to bring it up better. So just taking a few breaths like this one, things like that, and then starting to cough may actually help you move that mucus. So that will actually help you. The third thing I would consider is to consult a physiotherapist. So this is a person who will teach you how to clear airway secretions, and then you can use some of those tips to take it home, to do yourself. You may have a family member or a carer, someone who helps you with your condition to help you implement those things. So they may teach you techniques such as, for example, tapping on certain areas of the chest. It may be that one side of your chest builds up more mucus, so you may want to sort of lean the other way when you're coughing. This is something you can discuss with your physiotherapist, and they will recommend all kinds of things that you can use at home. So it's really important, I think, to have that consultation with a physiotherapist, and they will work with your doctor to find out the best way for you. The fourth thing would be to maybe consider certain devices that can help with clearing airway secretions and mucus. So these may be things like vibrating devices. So sometimes the physiotherapists may use these and they may advise you, and someone from your family or a carer may be able to teach you how to use these or help you to use them. And you can basically put them on certain areas of your back, for example, or someone can help you do that. And it tends to vibrate a little bit, make the mucus loosen, and you can cough it up. The other thing would be Flutter valves. So these are these little devices. When you breathe out through some tubes that contain this valve, it tends to induce a vibration in that airflow that sometimes helps loosen the mucus, and you can cough it up a little bit better. The fifth tip would be to consider nebulizers, so nebulized medication. So again, your physiotherapist or your doctor may advise what you can use. Sometimes when you use nebulizers, you can use normal saline, so normal saline solution, or hypertonic saline solution. So this is where the salt content is a little bit higher, and it tends to cause a little bit of irritation, draw some water into the airways, and you can cough up the mucus a little bit better. But it's important to check with your doctor or physiotherapist because, for example, hypertonic, high salt content solution that you can use to generate aerosols with your nebulizer may actually irritate the airways and cause a bit of bronchospasm. So it's important to check whether you tolerate that, or if you can only use normal saline solution in the aerosol generating nebulizer. But that can sometimes loosen the mucus, help you sort of clear it a little bit. The sixth tip would be to maybe consider with your doctor some medications that can help change the structure of the mucus, make it a little bit runnier, looser, so that you can cough it up. So things like acetylcysteine, ACC, sometimes that can help a little bit, but it depends, not for everyone. Some people may actually find that to cause more irritation in the airways and actually worsen the cough. So it's important to just check with your doctor if certain medications may be right for you to help loosen up the mucus. The seventh tip would actually be to avoid certain cough medications that are designed for dry cough. So if you're having a wet cough, you're having a lot of respiratory secretions that you can clear, actually taking a medication that suppresses the cough reflex, cuts it completely. So things like opioid medication, codeine, things like that, they actually may worsen the problem because you may not cough, but the mucus tends to pool, build up, and then you can't bring it up. You're overwhelmed with the secretions that build up that you can't cough out, because the cough is a natural reflex of the body to clear something from there. So avoid certain medications that are for dry cough, potentially if you have a wet cough, and maybe consider certain medications that may loosen the mucus. This is something you can check with your doctor. And I think to conclude, number 8, the eighth thing to consider, to go for regular checkups with your doctor to see if you're on the right treatment for your condition. So for example, if you're struggling with bronchiectasis, with dilated airways, you get a lot of chest infections, a lot of over-added infections, let's say, you may want to consider whether a preventative antibiotic can help you to limit the number of these episodes when the mucus tends to build up a lot, or if you need to treat a certain colonizing bacteria in your airways that may sort of be responsible for some of the increased mucus production, things like that. Make sure you're on the right treatment. Check with your doctor if you're on the right treatment for your condition that's causing the mucus. So I think these are a couple of tips that I wanted to share with you in this video. Hope you find it helpful. And if you have further comments, questions, queries, leave them in the comment section below. I'll see you in future videos. Good health. All the best.